Greetings, everyone. I'm Dr. Carmen Pugliafito, and I'm here today with Dr. David Lally of New England Retina Consultants. Dr. Lally is also an assistant professor of ophthalmology at Tufts University School of Medicine and at the University of Massachusetts. And today we're going to talk about the RECLAIM-2 study, which is a unique approach to the management of geographic atrophy going forward. David, welcome to Retina Synthesis.
Great. Well, thanks so much, Carmen, for having me. I'm excited to be here.
Tell us about the RECLAIM study and the molecule involved.
Yeah, absolutely. So, it starts with, attacking, I think the story with RECLAIM-1 and Elamipretide starts with that they're using a unique approach of looking at the mitochondria in the disease of macular degeneration. So it's a very unique hypothesis and target for targeting for the treatment of macular degeneration. So why the mitochondria? And the story really starts with it. We know that mitochondria are very important intracellular organelles. They're present in every cell in the human body, and they're critical for the synthesis of ATP. And the retina actually is the highest consumer of mitochondrial ATP of like any of the neural tissues in the human body. And that's because there's a really intense bioenergetics that are required to support our normal visual function. So our eyes are open all day long and we're receiving all day long light, external stimuli into our eyes. And these cells have very high metabolic demands. So right off the bat, there seems like there could be a role for the mitochondria in this disease. And we do see that mitochondria, there are some signs and signals that mitochondria may be implicated in the pathogenesis of AMD. So we see that mitochondria located at the bottom or the basal side of the RPE cells near the drusen. When we look under microscopes, we see that in these AMD eyes that the mitochondria can appear like dysmorphic in their phenotypes. And we also know that there can be increased oxidative damage to the mitochondrial DNA in these AMD eyes. And then the other things we know is that there's a genetic disease with a mitochondrial DNA mutation called maternally inherited diabetes and deafness, or MIDD. And these patients, oftentimes come to our clinics with this macular atrophy phenotype, which has some resemblance to the phenotype of geographic atrophy and macular degeneration. So that's kind of interesting. And then we also know that some of the modifiable risk factors that we know for AMD, such as cigarette smoking and high fat diet, that these factors are known to really increase mitochondrial oxidative stress. And so kind of all of these preclinical observations and findings kind of lead to some suggestion that mitochondrial dysfunction may in some way be involved in the pathology of macular degeneration. So there is a molecule that's currently under development in the RECLAIM-2 trial called Elamipretide. And the way that this drug works is if we think about the major structures of the mitochondria, there's really a few of these structures, and they include the inner and outer mitochondrial membranes, and then the cristae and the electron transport chain. But what we also know is that there's this very unique phospholipid that's in the inner wall of the inner mitochondrial membrane called cardiolipin. And cardiolipin is only found in mitochondria. It's not found anywhere else. And it's an important structural component to mitochondria, where it actually acts as like a linchpin to kind of hold together the respiratory complex units of the electron transport chain. And we know that cardiolipin is susceptible to peroxidation and to reactive oxygen species formation. And so if cardiolipin becomes damaged, we can see under the microscope that the normal curvature of the cristae can actually start to become flattened, and it actually takes on an abnormal shape of being flattened. And what that does is that puts those respiratory complexes out of their proper spatial orientation to each other. And that leads to an unhealthy electron transport chain. And so the formation of ATP goes down, and the reactive oxygen species formation starts to go up within the cell. And so elamipretide is known to bind to cardiolipin and help stabilize it and actually improve the curvature of the cristae and try to restore it back to its normal appearing morphology. And we know that this drug, when it does that we then see increases in ATP production in consequence of doing that. And we see that the reactive oxygen species formation goes down. And so this theoretically can help the cell and prevent apoptosis or cell death.
So it's really a mitochondrial rescue molecule?
Yeah, I mean, that's the best understanding that we have now, is that it really is it's really rescuing the electron transport chain with the goal of improving the function of the mitochondria. So, you know, if we think back to that these mitochondria in the retina, they need ATP and good ATP synthesis likely more than any other neural cell in the body. And so if we can boost that function, then we may be able to handle the oxidative stress better for these aging eyes. And we know that oxidative stress is a major player in AMD. So if oxidative stress is a major player in the pathophysiology of this disease, then improving the mitochondria to deal with that oxidative stress seems like a reasonable strategy.
So tell us about the study.
Yeah, so you know, elamipretide was first studied in dry macular degeneration back in 2018 in what was called the RECLAIM-1 study. And this was done by Dr. Scott Cousins at Duke. And this was it was a phase 1 study looking at patients with intermediate dry macular degeneration. And what these patients do is they administer the elamipretide as a subcutaneous injection into the abdomen. So I almost think of it like a Humira pen or some other type of similar administration, where each day the patient is injecting the medicine into the abdomen daily. And I think it was 40 milligrams. And they did that for 24 weeks. And the primary outcome was looking at safety events. And fortunately, there was no severe safety. There were significant safety SAEs or treatment emergent AEs. We did see that there was a common local skin site reaction to the injection in the abdomen. These were kind of common local skin injection reactions that you would expect with other types of medications that are administered into the abdomen in a similar manner. So, you know, itching of the abdomen, bruising, bruising, and what was the other one? Bleeding. But these reactions typically were very self-limited and resolved within a few hours after the administration of the drug, and is what you would expect given the clearance rate of the drug. So we saw that it appeared safe in the phase 1, but they also had in that phase 1 study a subset of eyes that were 19 of these eyes that had non-central geographic atrophy that was secondary to AMD. And they looked at some exploratory efficacy endpoints in this trial. And what was interesting is that they saw after 24 weeks of administration of this drug that subjects had on average about a 5-letter gain in both best corrected visual acuity, but also low luminance visual acuity. And even more interesting, when they looked at the different baseline lesion sizes of these non-central geographic atrophy patients, they saw that smaller baseline atrophy lesions actually had greater gains in their low luminance. And so there was some consistency seen here with these exploratory endpoints, with multiple exploratory functional endpoints. And so that drove the development to the next phase of testing, which is the current ongoing phase 2 trial called the RECLAIM-2 study. And so this study is a study that's specifically looking at elamipretide for the treatment of just non-foveal geographic atrophy, where patients are randomized to either receive the Elamipretide as a 40 milligram subcutaneous injection in the abdomen, or a placebo injection for 24 weeks. And the primary outcome for this study is going to be the change in low luminance visual acuity from baseline to month 24. So going for a functional endpoint, which is different than a lot of our other ongoing geographic atrophy studies, where the primary endpoint is a structural endpoint. This study is hoping to achieve a functional outcome in their phase 2 study. So the study is currently fully enrolled. There's 176 subjects that are enrolled. All the sites are from the United States. And the results, I think, are anticipated in the second quarter of next year.
Why does low luminance visual acuity improve?
Yeah, I think it goes to the thought that that macular degeneration affects the rods before the cones typically. So when we look at what are some of the earliest functional measures of visual dysfunction in macular degeneration, we often see that there's delayed dark adaptation as one of the measures. And so I think turning the lights down low and measuring visual acuity is perhaps getting the rods more involved. And when we're looking at earlier stages of disease, so one thing I forgot to mention was that the baseline size of these non-central atrophic lesions for this trial can be much smaller than what we have in our other ongoing GA trials, and that's because, again, the primary outcome is not a structural change on autofluorescence, but a functional change. But we're getting kind of an earlier stage disease, and so there may be more rods and photoreceptors out there to salvage and boost their function, as opposed to later stages of large foveal geographic atrophy lesions or large non-central lesions. So I think there is a real thought of this hypothesis that if we can boost the mitochondrial function that within these photoreceptors, that you can see a functional improvement in these eyes.
What was the visual acuity and enrollment criteria?
For Reclaim 2, the vision had to be greater than or equal to 55 letters.
Mm-hmm.
And the low luminance visual acuity at baseline had to be greater than or equal to 10 letters. And so the patient must have had at least a low luminance deficit of greater than 5 letters. So they had to have some kind of deficit at baseline, so you can have the opportunity to see a change at that primary outcome measure. But in terms of best corrected visual acuity is 55 letters.
Mm-hmm. So it's intriguing. This seems like a potentially good treatment for intermediate AMD, correct?
Absolutely. Absolutely. I think, the same hypothesis applies to intermediate AMD, is that if we certainly know in intermediate dry AMD cases, these patients have delayed dark adaptation. They can be symptomatic with symptoms. They're often coming to us saying, even if their visual acuity is, relatively good on the eye chart, the patient can still be symptomatic where they start complaining of their struggles with going from a light room to a dark room, or a dark room to a light room, how it takes their eyes a much longer period of time over time. And I think exploring these types of mitochondrial therapies in intermediate dry AMD would be kind of the next step, would be going to earlier stages of disease.
Well, this is a very intriguing and promising trial. It doesn't have anything to do with the complement pathway. Is that right?
Has nothing to do with complement pathway. Yeah. So, yeah, I agree. I think that's one thing that makes this trial exciting, is that it's different from the complement pathway. It really is a novel approach to trying to treat this disease. But my understanding is it does not affect the complement system in any manner. It specifically only affects cardiolipin. And again, cardiolipin is only found in the mitochondria. So it's not found in any other part of the cell.
Well, that's great. We'll have you back when we get Reclaim 2 results in. David, thanks so much for your participation on retina synthesis.
I appreciate it. Thanks so much, Carmen.